So continuing with hypertension, moving on to the pathophysiology of hypertension. So before starting with the pathophysiology of hypertension, we will move on to the normal regulation of blood pressure. Okay, how the blood pressure is being maintained. Okay, this normal regulation of blood pressure you might have already studied in physiology. So we will just briefly recollect all this different factors which influence blood pressure. Okay, because when we study the pathophysiology of hypertension, all these different factors are being involved. So already all are aware what is blood pressure. Blood pressure is a pressure that is exerted by the blood as it is flowing through the blood vessels. Okay, so blood pressure is given by cardiac output into systemic vascular resistance. Okay, so systemic vascular resistance is also called as peripheral resistance. I know all are aware about it, isn't it? So it is a resistance in the circulatory system. Okay, and that will create the blood pressure there. Okay, so remember that whenever there is increase in any of these values, it could be the cardiac output or it could be your peripheral resistance, any of these values are increased, it is going to increase your blood pressure. Okay, so we know there are a lot of factors which increase cardiac output that you have already studied, isn't it? And there are certain factors which can increase peripheral resistance also. So whenever there is increase in the systemic vascular resistance or whenever there is increase in peripheral resistance, what happens is it is going to result in vasoconstriction. Okay, so what will happen to the blood vessels? They will become vasoconstricted, that is, they become narrow. Already I think I might have given the examples, isn't it? When the diameter is more, what will happen to the force or pressure? It is less. Okay, same amount when it is traveling in a narrowed vessel or a narrowed pipe, what will happen? The force or the resistance or the pressure will be more. Okay, so that is what we will be what it is happening in your blood vessels also. And moreover, in most of my slides I will just be mentioning CO, which refers to cardiac output. Okay, same thing I have written over here. Blood pressure is equal to cardiac output into systemic vascular resistance or peripheral resistance. Now cardiac output is also given by heart rate into stroke volume. Okay, heart rate into stroke volume. So how cardiac output will increase? Whenever your heart rate increases or if the stroke volume increases, it will increase your cardiac output. So if cardiac output increases, blood pressure is also going to increase. Now next is moving on to the regulation of blood pressure. This same thing you might have studied in physiology. Okay, we'll just briefly see what are the points here. Okay, which is affecting the heart, only that we are studying. Okay, or what is affecting your blood pressure, only that is being covered. Okay, so first of all, we have got different regulations of blood pressure by different mechanism: nervous mechanism, renal mechanism, hormonal mechanism, and local mechanism. So under nervous we have got SNS, that is sympathetic nervous system activity. Then we have got parasympathetic along with that, baroreceptors, chemoreceptors, and then we have got some vasomotor centers like vasoconstrictor area, vasodilator area. Under the renal mechanism we have got the regulation of extracellular fluid volume, RAS mechanism, that is renin angiotensin mechanism. Hormones, there are a lot of hormones which influence the blood pressure. And then the local mechanism, under that we have got the vascular endothelium. You know the endothelium, isn't it? So endothelium is a layer that is lining the blood vessel. So that also is having a regulation of the blood pressure. That also we'll see what and how. So first of all, moving on to sympathetic nervous system and parasympathetic activity. So I am sure that all of you may be already learnt about this term SNS, isn't it? So our sympathetic nervous system is having both alpha and beta receptors. So under that we have got alpha 1 and alpha 2 receptors. Again under beta receptors we have got beta 1 and beta 2 receptors. Okay, we are not dealing everything in detail. Again I am telling only that is influencing the blood pressure I am going to tell. Okay, so in the alpha receptors, they are actually located on the artery. Okay, and most of the time what happens is they are stimulated by the hormones epinephrine and norepinephrine. I'll repeat again. Alpha receptors are located in the artery and they get stimulated by the hormones epinephrine and norepinephrine. Epinephrine is also called adrenaline and norepinephrine is also called noradrenaline. What will happen because of the influence of these hormones? These hormones will result in vasoconstriction. Again I tell vasoconstriction. So vasoconstriction means what will happen? It is getting narrowed. Okay, the blood vessels are getting narrowed. So what will happen? The blood pressure will increase. Okay, so that is a function there. Okay, remember the alpha receptors result in vasoconstriction. How? Mainly because of the hormones like adrenaline and noradrenaline. Okay, next is beta receptors. Under that again we have got three types also. Okay, like beta 1 and beta 2 is there mainly. Now beta 1, you know, it is located in the heart. Okay, the beta 1 receptors are located in the heart. It tends to increase your heart rate. But your beta 2 is located in the bronchioles of the lungs, and also it is located in the juxtaglomerular cells. Okay, in the kidneys. Okay. So what does this beta 2 do? Beta 2 is mainly responsible for relaxation or vasodilation, that is relaxation. Okay, next is parasympathetic activity. Now when I mainly use the term sympathetic nervous system, you should remember it results in vasoconstriction. Okay, when I tell parasympathetic, you should remember that it is just the opposite of sympathetic nervous system. Okay, parasympathetic will reduce the heart rate. If heart rate is reduced, what will happen? The BP will also reduce and cardiac output also will be reduced. But sympathetic nervous system is just the opposite. Okay, in sympathetic nervous system there is increased heart rate. So what will happen? Increased cardiac output, increased blood pressure. That much you have to remember. Now, how the sympathetic nervous system is stimulated, that I will be telling. So already I have told, whenever you have got any stress, for example, okay, whenever you are exposed to stress, what will happen is your sympathetic nervous system is activated. Okay, your sympathetic nervous system will be activated, and that time there is release of the hormones epinephrine and norepinephrine. So already I have told about the speciality of this epinephrine and norepinephrine. This epinephrine and norepinephrine, they are resulting in vasoconstriction. Okay, so vasoconstriction means what will happen to the blood vessel? It will be narrowed. That is, the lumen will become narrowed. Blood vessel itself gets narrowed. So what will happen when it becomes narrowed? The peripheral resistance is more, or the systemic vascular resistance will be increased. So what will happen when the resistance is more? Obviously there is increase in the blood pressure and increase in the heart rate. Okay, so this is that is happening because of the sympathetic nervous system. Next is moving on to your baroreceptors. Now there are so many things you have to study regarding baroreceptors, but the important thing that you have to know is baroreceptors are pressure sensitive receptors. Whenever there is any alteration in the blood pressure, it will be detected by the baroreceptors. Okay, baroreceptors are located in the aorta as well as carotid sinus. Okay, so whenever there is increase or decrease in the BP, immediately baroreceptors will come to know and they will start to have the compensatory mechanism. Okay, for example, when increased BP is there, what the baroreceptors will do? They will sense it and they will try to lower the BP. Okay, and when the BP is very low, what the baroreceptors will do? They will again sense it and they will tend to increase the BP. Okay, so this is the main function of the baroreceptors. Now we will see how exactly baroreceptors are acting. Whenever there is increase in the BP, already I told it is detected by the baroreceptors because they are pressure sensitive. Okay, so once the baroreceptors detect it, they will send impulse to the medulla oblongata in order to control the BP. Okay, then what happens is it will inhibit the sympathetic nervous system and activate the parasympathetic. Inhibition of sympathetic nervous system means what happens? Inhibition of sympathetic nervous system means your heart rate and cardiac output and BP will become reduced. Okay, and there will be activation slowly of the parasympathetic nervous system. Okay, activation of parasympathetic nervous system means what? That is also trying to reduce the blood pressure, isn't it? That is also trying to reduce the blood pressure. So totally what will happen? there is reduction in the BP, reduction in the heart rate, and reduction in cardiac output. So therefore, blood pressure which was increased, finally what happened? It has reduced. That is, it has become stable. I am not telling it has reduced and become hypotension. No. The BP which was increased has become normal now. How? Because of the baroreceptors. Okay. So just remember that baroreceptors will sense the change in the BP. Increase or decrease in BP, they will sense it and they will have the compensatory mechanism. So here what has happened? BP has increased, that is sensed by baroreceptors. So they will do some action here. What they are doing here? They are inhibiting sympathetic nervous system and activating parasympathetic. So that because of that, what will happen? The increased BP has decreased and it has become normal. Okay. So that is regarding the increase in BP. Now next one. Now next is what happens when the BP is decreased. Now already I have told you regarding what happened when the BP was increased. Now next I am going to tell what happens when BP is reduced. When the BP is reduced again, when there is hypotension, it is sensed by the baroreceptors. Okay, so baroreceptors will sense it and again it will send impulse to the medulla oblongata to control the BP. Okay, now what happens is opposite. BP is reduced, isn't it? So what you have to do to increase the BP? There will be activation of sympathetic nervous system. Okay, activation of sympathetic nervous system and inhibition of parasympathetic. So obviously what will happen because of that? What will happen because of activation of SNS? There will be increase in the blood pressure, increase in the heart rate and increase in cardiac output. So therefore, what will happen? The BP which is reduced has come to increased BP and it has become stable. Okay, so BP which was reduced has become stable now. Okay, so that is how your baroreceptors are acting. Next is moving on to chemoreceptors. Now chemoreceptors are, as the name indicates, chemo, okay, means certain chemicals which are present in the blood circulation. Okay, these chemoreceptors are sensitive to lack of oxygen. That is, whenever there is hypoxia in the blood, chemoreceptors are activated. Okay, so whenever there is more carbon dioxide, less oxygen, or whenever there is hypoxia, immediately chemoreceptors are they will detect and they will do some mechanism. So what will happen is the chemoreceptors, whenever there is any problem with the BP, that is whenever there is low oxygen in the blood, it will stimulate your chemoreceptors. Okay, that will stimulate your chemoreceptors and they will excite the vasoconstrictor area. Okay, so whenever there is decrease in the BP, it is indicated to the chemoreceptors. It will be understood by chemoreceptors and they will excite the vasoconstrictor area. What will happen when the vasoconstrictor area is excited? What will happen to the vasoconstrictor area? It becomes again resulting in vasoconstriction. That is what? Narrowing. What will happen when there is narrowing? The pressure will increase, isn't it? And what will happen to the heart rate and BP? It will be increased. Okay, so that is how cardiac output will increase and slowly oxygen circulation also will be starting to all the organs. So that is done by chemoreceptors. Okay, so always remember that so many mechanisms are there that you will study in the regulation of blood pressure. Okay, initially all these mechanisms are able to act. Okay, all these mechanisms will be acting well, but slowly what happens is slowly the mechanisms will fail. They will fail to control the blood pressure. That is what happens in case of severe hypertension. For example, when you have a rubber band, you know, it is having a stretching ability. Okay, now every day you are using the rubber band, one day it will become very loose. It is going to lose the elasticity or its function will be lost, isn't it? Here also same way. Okay, so what happens is initially all these mechanisms will work. They will try to control the BP by some way or the other, but finally they will fail. Then what will happen? The heart's workload will be more. The ability of the heart to pump the blood, that workload will increase. Okay, so that is why finally it will result in heart failure. That you should always be aware. Okay, so here also all the mechanisms are going to be failed. Okay, so that is going to happen. Next we will see is renal mechanism. Okay, in the renal mechanism also, that also helps to regulate the blood pressure. Now we will see both the RAS mechanism also, and then we will see the regulation of extracellular fluid mechanism. Okay, we'll see what happens when BP increases, what happens when BP decreases. So whenever the BP is increased, what happens is, whenever the BP is increased, the kidneys will start to excrete more water and sodium. Okay, the kidneys will start to excrete more water and sodium. Now what will happen when the water and sodium is lost from the body? It will reduce the extracellular fluid volume, isn't it? It will reduce the fluid volume. What will happen when fluid volume is reduced? Your blood volume also is reduced. Now what happens when your blood volume is reduced? It will reduce your blood pressure. Okay, so that is how your blood pressure will become normal when the BP is increased. Okay, so remember, when there is high increase in the BP, it is sensed. Okay, it is sensed, and the kidneys will start to excrete more water and sodium. When more and more water and sodium is excreted, there will be decreased fluid volume. There is decrease in blood volume. So finally the BP will reduce and it will become stable. Now next, what happens when the BP decreases? Okay, we have seen what happens when the BP increased. Now just the opposite happens when the BP decreases. When the BP decreases, here the fluid volume is, the sodium and water will not be excreted. Okay, so instead what will happen? The kidney will reabsorb the water. Okay, so kidney will reabsorb the water. So what will happen when reabsorption happens? The fluid volume will increase. Okay, so the extracellular fluid volume increases. So what will happen to the blood volume? That will also increase. Okay, so that will also increase. So finally what happens is, there is increase in the BP. So the BP which has reduced has come to normal now. It has returned to normal. Next is regarding the renin-angiotensin-aldosterone mechanism. Okay, that is a RAS mechanism. This is very important in regulation of the blood pressure. So we already know renin. Renin is an enzyme that is secreted by the kidneys, isn't it? Renin is an enzyme that is secreted by the kidneys. I am just recollecting the points. And aldosterone is a mineralocorticosteroid that is secreted by the adrenal cortex. Okay, so that much you might have already studied. We'll see now what happens when your blood pressure falls. Same thing happens. When the blood pressure falls, it is detected by the kidneys. Okay, so what they will do is, they will stimulate the juxtaglomerular apparatus. Okay, it will stimulate the juxtaglomerular apparatus of the kidney. Okay, so this juxtaglomerular apparatus, what it does, it will secrete more and more renin. Okay, so renin is an enzyme. So what happens when more and more renin is secreted? Renin will start to convert angiotensinogen to angiotensin 1. Okay, it will convert, renin is converting angiotensinogen to angiotensin 1. Next, angiotensin 1 will get converted to angiotensin 2 by ACE enzyme, that is angiotensin converting enzyme. Okay, so always remember, finally what happens? Angiotensin 2 is being produced. Angiotensin 2 is actually a vasoconstrictor. Okay, angiotensin 2 is a vasoconstrictor. It acts in different ways, that I will tell later. So always remember how the blood pressure which has reduced will increase, mainly because of, one is your renin secretion, mainly because of conversion of angiotensin 1 to angiotensin 2, and mainly because of the enzyme angiotensin converting enzyme. So always remember, in the drugs when we are studying, okay, to reduce the BP, what we have to do? We have to use certain drugs which will prevent the conversion of angiotensin 1 to angiotensin 2. Okay, just remember this point later. It will be helpful for you. Okay, so this was regarding the mechanism that happens when the blood pressure falls. I'll just recollect it fast. When BP falls, it is detected by the kidneys. So it will stimulate the juxtaglomerular apparatus of the kidney to secrete more renin. So renin is an enzyme which converts angiotensinogen to angiotensin 1. Okay. Next, what happens? We have got one enzyme, an angiotensin converting enzyme, that is ACE. It converts angiotensin 1 to angiotensin 2. Now, angiotensin 2 is a vasoconstrictor. So, what will happen to the BP which has fallen? It has increased. Okay. And it has become normal. Now, already I told two things mainly happen in angiotensin, isn't it? So, angiotensin 2, it will constrict your arterioles in the body. Okay, angiotensin 2 is a vasoconstrictor and it also constricts the arterioles in the body, and because of that what will happen? The peripheral resistance will increase. So because of that BP increases, heart rate increases, cardiac output also increases. Okay. Now next is angiotensin 2 also constricts the arterioles in the kidney. Okay. So angiotensin 2, it constricts the arterioles in the kidney also. Not only in the body, it also constricts the arterioles of the kidney. So what will happen when there is constriction of the arterioles of the kidney? What will happen? Vasoconstriction means decreased GFR, glomerular filtration rate. So when there is decrease in GFR, what happens is there will be retention of water and salts. Okay, it will try to retain salt and water. I will tell you how it acts. Okay, I will tell you how it acts in the next slide. So because of the retention of water and salt, what will happen? Slowly the fluid volume becomes normal, blood volume becomes normal, and BP also returns to normal. Okay, so that is what happens in by this angiotensin 2. Okay, so angiotensin 2 is a vasoconstrictor. It acts on the body, it acts on the kidneys also. Okay, that much you have to know. Now next is we will see in detail what mainly happens by this angiotensin 2. Okay, how it is increasing the fluid volume. Here I told it will increase the fluid volume, isn't it? How it is happening, I will tell you. So angiotensin 2 is a vasoconstrictor and it stimulates your adrenal cortex. Okay, it stimulates the adrenal cortex to secrete the hormone aldosterone. Okay, so what will happen because of that? More and more secretion of aldosterone is there. So aldosterone is the such hormone which acts on the kidney, and the main function of aldosterone is it reabsorbs water and sodium. Okay, which is there surrounding, it will reabsorb the sodium and water. So what will happen when there is reabsorption? Not excretion, reabsorption. So when there is reabsorption, fluid volume will increase, blood volume will increase, and BP also will be increasing. Okay, so that was regarding the renal mechanism. Okay, next we will see the different hormones, how they are having effect on the blood pressure. Okay, so just you have to remember these. So many hormones are there. Now aldosterone is a vasoconstrictor. Vasoconstrictor means it will increase BP. Next we have got ADH or vasopressor, that is also vasoconstrictor, that is it is going to increase your blood pressure. Next we have got adrenaline, noradrenaline, that is epinephrine and norepinephrine, both are vasoconstrictors, that will also increase the BP. Next we have got thyroxine. Thyroxine is a vasodilator, dilates. What will happen? Because of that there is relaxation, there is decrease in the BP. Next one is serotonin. Okay, so serotonin is a vasoconstrictor, so it will be increasing the blood pressure. Bradykinin on the other hand is a vasodilator, it will dilate, relax, and it will decrease the BP. Next is some other hormones like histamine, prostaglandins, acetylcholine, all these are also vasodilators and it will reduce the blood pressure. Next is moving on to few other hormones. Okay, these are little bit difficult to remember, just remember the name. We have got natriuretic peptides. So natriuretic peptides are particularly found in the heart and they are vasodilators. What will happen? Vasodilators means it will dilate and relax and it will reduce the blood pressure. Okay, you don't require the types of it. Okay, so this was regarding the hormones. Next I told you there is endothelium. The endothelium is lining the blood vessels. Okay, and this endothelium also produces some vasoactive substances. It produces some vasoactive substances, some other growth factors also. Okay, and it is noted that this vascular endothelium, that is a lining, this is actually a vasoconstrictor. Okay, it tends to increase the blood pressure. Okay, so that is the normal regulation of this blood pressure. Okay, next we will see the pathophysiology of hypertension. Now already I told you what happens is all the mechanisms will fail, then only there is increase in your blood pressure. So you can tell that whichever mechanism you studied, regulation of BP, everything will fail. Okay, so we will see due to etiological causes. Okay, we are dealing regarding the pathophysiology of hypertension. Due to etiological causes like maybe hyperglycemia, increase in blood sugars, insulin resistance, genetics, environment, some risk factors like obesity, increased cholesterol, increased salt intake, stress. Okay, during all this, what happens initially, there will be stimulation of sympathetic nervous system. Okay, so your sympathetic nervous system, that will be dysfunctioned or damaged, and even your natriuretic peptides, just now I told about it. Okay, that also will be damaged. So what will happen when this SNS is damaged, even your natriuretic is damaged, what will happen? Continuously there will be vasoconstriction. Okay, and continuously increased BP. Okay, so continuous increase in the BP, what will happen? Your baroreceptors and chemoreceptors will not act. Why? Only when there is problem for some time, what will happen? Baroreceptors, chemoreceptors may try to control the BP, but continuous persistent increase in the blood pressure for a very long period of time, 10-15 years, what will happen? Your baroreceptors and chemoreceptors will not act, and what happens here? Increase in the BP, finally increase in BP. Next is, already I told us, there can be damage to the vascular endothelium. Okay, whenever there is damage to vascular endothelium, what will happen? Again, continuously there can be vasoconstriction, and that also will increase the blood pressure. Next is, there can be impairment in the renin angiotensin aldosterone mechanism. What happens here? It will stimulate your renin. Okay, it will stimulate the renin, and what will happen? Renin will convert more and more angiotensinogen to angiotensin 1, and angiotensin 1 will be converted to angiotensin 2 by angiotensin converting enzyme. We know angiotensin 2 is vasoconstrictor. What will happen? It will stimulate the adrenal cortex to secrete aldosterone. So more and more aldosterone is produced. That will reabsorb all the sodium and water. What will happen if all the sodium and water is reabsorbed? Your blood volume will increase, your fluid volume will increase, and your BP also increases. Okay, so this is particularly that happens in the pathophysiology. You can just write down this pathophysiology, okay, flow chart. Next, we will move on to the medical management or pharmacological management of hypertension. It is a very important topic, may be important in pharmacology, but very important in medsurg also. Okay, they have even asked to explain the drugs here. Okay, we are not discussing the action, mechanism of action. I will be discussing regarding antihypertensives. So what is our goal of hypertension here? Our main goal should be to reduce the blood pressure. And we should see that the organs are not damaged. There are no complications, and there should be minimal side effects of the drug. Okay, so these many drugs are there in antihypertensive classification. Okay, there may be little changes in pharmacology. Okay, this is what we are studying in medsurg. Okay, so we have got diuretics, beta adrenergic blockers, we call it as beta blockers. Next is alpha blockers, also called as alpha adrenergic blockers. Next is alpha beta blockers. Next, vasodilators, calcium channel blockers, and then we have got AC inhibitors. Please note down here, inhibitors word is missing. Okay, AC inhibitors, angiotensin 2 receptor blockers, alpha adrenergic antagonist. Okay, so all these are important. Okay, very easy also. So first we will study regarding diuretics. Now diuretics are those group of drugs which reduces the blood pressure. What they do is, these diuretics, as the name suggests, they will enhance the excretion of sodium and water from the body. So whatever edema is there or whatever retention is there, the water and the sodium will be removed from the body. So what will happen to cardiac output? It will be reduced. BP also will be reduced. So we have got mainly three classifications of diuretics: loop diuretics, thiazide diuretics, and potassium sparing diuretics. One more classification is there, osmotic diuretics, that we are using when your intracranial pressure is more. Now we need only three, okay, that is loop diuretic, thiazide diuretic, and potassium sparing diuretic. So example of loop diuretic, all of you will be aware of it, isn't it? Lasix or furosemide. Thiazide diuretic example is hydrochlorothiazide or chlorothiazide. And potassium sparing diuretic is spironolactone and amiloride. Next is beta blockers. Now beta blockers are also antihypertensives. They reduce the workload on the heart. Therefore, it will reduce the cardiac output. It reduces the BP. Example of beta blockers are, please you have to remember the names of the drugs. All the beta blockers end with LOL. Remember that much. Okay. Atenolol, propranolol, metoprolol, timolol, nadolol. Okay, here you can see the picture of propranolol. Mainly, you should remember that when you are giving this beta blockers, you have to monitor the pulse of the patient and monitor the BP, because it is an antihypertensive. Most of the time, patient can develop dizziness or giddiness. Okay, and you have to also monitor the pulse rate. Okay, and this particularly beta blockers are told to cause bronchospasm. So use it cautiously in patients with the respiratory problems like asthma, COPD, bronchitis and all. Okay. So most of the time beta blockers are not given to such patients. Okay. Those who are having history of bronchospasm. And also it can result in hypotension. So continuously monitor the pulse and the blood pressure. That was regarding beta blockers. Next is alpha blockers. Now alpha blockers, that also is an antihypertensive drug. It reduces cardiac output, reduces the blood pressure. Okay, and it also slows the heart rate. Example of beta blockers are prazosin, terazosin, doxazosin. So you can feel the ending is zosin, isn't it? And the main side effect is alpha adrenergic blockers most of the time can cause orthostatic hypotension. Sudden there can be decrease in the BP when you are getting up from the sleeping position to standing position. And most of the time alpha blockers are given with the beta blockers or diuretics. Next classification is alpha beta blockers. Now alpha beta blockers, these drugs reduce the heart rate. Okay, they also reduce the BP. They are the antihypertensives. Example are labetalol and carvedilol. Okay, and main side effect is, since they are antihypertensives, they reduce the BP. Continuously if you keep on taking the drug without monitoring BP, it can cause hypotension, bradycardia, that is decreased heart rate, sometimes giddiness or dizziness. Next classification is vasodilators. Very important classification, especially you will study in myocardial infarction, angina. Okay. So vasodilator, as the name suggests there, it dilates the smooth muscle. That means it is relaxing the smooth muscle. Therefore, it will reduce the BP, reduce the cardiac output. Main examples of vasodilators are sodium nitroprusside, hydralazine and nitroglycerin. The most important cardiac drug, nitroglycerin. Okay. So nitroglycerin, as we know, it is available in different forms. It is available in the form of tablet, available in the form of sprays, available in the form of creams, injections also it is available. Okay. So nitroglycerin is one such drug which is given sublingual, means it is kept under the tongue. Okay. And whenever a person experiences chest pain and all, commonly initially we give this nitroglycerin tablets. It is kept under the tongue. Okay. Next classification of antihypertensives is calcium channel blockers. Example amlodipine, nifedipine, diltiazem, verapamil. Okay, now as the name suggests, they will block the movement of calcium into the cells. Okay, so therefore it will reduce the BP and heart rate. So these are the examples of calcium channel blockers. Next is AC inhibitors, angiotensin converting enzyme inhibitors. Okay, these are antihypertensives. Okay, remember A and C from here. For example, okay, A and C. We have got examples of AC inhibitors are captopril, enalapril, lisinopril and ramipril. Okay, so this ACE inhibitors will inhibit the conversion of angiotensin 1 to angiotensin 2. I told you when I was discussing the pathophysiology, isn't it? So what happens if angiotensin 1 is not converted to angiotensin 2? It will reduce the blood pressure. Side effects are it may result in hypotension, dizziness or giddiness and cough. Next one is angiotensin 2 receptor blockers. So these drugs will increase the excretion of sodium and water. Okay, thereby it will reduce the blood pressure. Example are losartan, telmisartan and olmesartan. Next is central acting alpha adrenergic antagonist. So these drugs also reduce the blood pressure and heart rate. Thus they will result in vasodilation. Example are clonidine and methyl dopa. Okay, clonidine and methyl dopa. The main side effects are it will result in giddiness or dizziness. Sometimes patient can feel drowsy, especially your clonidine. Okay, patient can feel excessively drowsy. Dry mouth also is seen. So avoid driving, okay, or avoid crossing the road alone and all after taking this drug. Okay, so this is particularly regarding the medical management.